Hello everyone, my name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar. During today's presentation, you will learn your SBHC through a medical legal partnership can provide patients with legal services for issues that directly affect their health, better organize your services and programs to address SCOH, and further increasing the efficacy of health interventions. The Alliance is very excited to host the webinar today along with amazing presenters. Here at School-Based Health Alliance, we believe that all children and adolescents deserve to thrive. We connect our sector to national community of peers. We support our field with common standards, measures, data, and research. We advocate at federal, state, and local levels for a concept of health and education partnerships. We provide the field with high-quality resources, training, and motivation and inspiration to excel in their work. When health and education come together, great things happen. Now, before we begin, we do have a few housekeeping reminders. All attendees are in listen-only mode. However, we would love to hear your questions. If you have any questions during the webinar, please feel free to enter your questions in the Q&A tool that appears in your Zoom control panel. Also, following the presentation, we will have evaluation poll questions. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please visit School-Based Health Alliance for other archive webinars, such as the ones you are currently viewing on your screen. We would now like to introduce our presenters today.
Good afternoon. My name is Selena Moore, and I'm a program manager here at the School-Based Health Alliance, overseeing our Youth Safety Net project, which is funded by the Bureau for Primary Health Care as a national cooperative agreement. And I'm excited to talk with you all about SBHCs and their connection to MLPs.
Great. Hi, everybody. I'm Ellen Lawton. I'm a co-director at the National Center for Medical Legal Partnership at George Washington University. Excited to be here with my co-panelists and leaders to talk about medical legal partnership at school-based health centers. And this is part of our work with HRSA's National Cooperative Agreement. So excited to share some of our insights and learnings. Thanks.
I'm Anna Kaskin. I'm the medical director of the School Health Center at Anacostia High School and the deputy medical director of the Georgetown University Health Justice Alliance. And just a few short years ago, I was totally unfamiliar with medical legal partnerships. So I'll be telling you about what I've learned and what we've been able to put together in a fairly short amount of time.
Hi everyone, I'm Lisa Kessler. I'm the program manager for the Health Justice Alliance at Georgetown University, working closely with Anna and other healthcare providers throughout the MedStar system. And yes, Anna and I are really excited to share how our teams have collaborated to start providing legal services to the patients at her school health center.
And I'm Martha Glenn. I'm a family nurse practitioner. I'm the site medical director for our school-based and adolescent programming at a FQHC in Chicago. And I'm going to talk about some of the legislative changes that came about based on some of our legal referrals and our experience with our medical legal partnership.
So to start us off, this is Selena Moore again. As many of you may be familiar, and if you're not, we talk a lot in the fields of health and medicine and social sciences about social determinants of health. And when we think about them, of course, we always understand it from that terminology of the places where people live and work and play. And it's no different for young people. It's just when we think about how those different social aspects of life are impacting them, sometimes it can be very different from the way we think about it for adults. And so it's always important in the work that we do, and whether you're thinking about the impacts of economics or built environment, that we think about how we can align the work that we're doing to improve those, not only for adults, but as well as young people and the connection of youth and families. And for those who are providers, and I think this even rings true for other aspects of health profession, we recognize the importance, and you all recognize the importance of social determinants and needs and how they connect to those physical and more clinical aspects of health, but not always knowing how within the clinic settings and the services that you provide, how to address those social needs effectively and even identify them. But when those needs go unmet, they directly relate to continued health needs that go untreated or unmet because of the social side of it. And so the work of school-based health centers are intrinsically a part of that, addressing the social as well as the clinical needs. It's an ideal partnership where that intersection of health and education, and where young people spend the majority of their time, you're able to bring together those other aspects of social needs along with the medical provisions of care to be able to provide a well-rounded, holistic care for young people and their families. And the school-based health center field is large and wide, over 2,500 health centers and programs across 48 of 50 states, and including the District of Columbia in Puerto Rico. And the models that these school-based partnerships, along with SDOH, like MLP that we're talking about today, take place across a variety of models within the SBHC world, from your traditional fixed site in a school all the way to a school-linked, mobile, and even telehealth. And as we talk about the work that SBHCs are doing, they are more than just the clinical care that they provide. They're doing all of these different SDOH related needs right in the school settings or in partnership with community organizations. And from our latest census, we found that that was answered by 2,080 of them, the different aspects of care that they're providing that connect to social determinants of health. And out of 1,197 of them, 231 of them are providing legal services programs and community partnerships through the school-based setting, and it's growing more and more each day. And so I'm now going to turn it over to Ellen to talk more about how the medical legal partnership model looks in schools.
Great, thanks so much, Selena, and for teeing this up for us to talk specifically about what it looks like when we weave legal services directly into the healthcare context. And you have in front of you a working definition of medical legal partnership as an intervention where legal and healthcare professionals are collaborating to help patients resolve social and environmental factors that contribute to health disparities and have a remedy in civil law. And that is absolutely true, but it's also really about building a better team to tackle some of the issues that Selena referenced in her opening. And you're going to hear from two programs that have formed these relationships that are really transforming how they're thinking about the care that they're delivering on the health side and the impact that they can deliver on the legal side. Oops. Take it to the next slide here. I want to reference and make sure that everyone on the call is aware of a really terrific tool that we put together jointly with School-Based Health Alliance that goes into some detail about the work you're going to hear about today, and also just kind of gives you a foundational understanding both of school-based health centers, but also really medical legal partnerships and how we think about health-harming legal needs for children and adolescents. So make sure to download that, and I think we can make that available in the chat also. And again, just very basically talking about what is medical legal partnership is about embedding lawyers as members of the healthcare team, and you'll get to hear from the Georgetown and Erie programs about how they think about their activities jointly once they're in the healthcare setting together. Another reference tool for those of you who are new to medical legal partnership is a piece we did in Health Affairs last year that talks about the core components of medical legal partnership as you're thinking about how to build your own in your community or your clinic, and what are some of the things that you'll need to think about, so you can access that on our website. And then this is the tool that we use called iHelp, a screening tool that's been customized in our joint work with SBHA around helping to understand what are the legal services that address social determinants for youth. So you can see some examples here, and you'll be hearing from, again, our speakers about how those are relevant to the work that they're doing. We also, last spring, published a Patients to Policy series that talks about some of the policy changes that emanate from individual case handling that happens in the medical legal partnership context. And in particular, Erie Health Center is featured in one of those Patients to Policy stories. And so just refer you to our website to check that out, and Martha will go into detail. And we're about to update our numbers actually, probably closer to 400 healthcare organizations in 46 states that are practicing medical legal partnership in some way, shape, or form, and happy to talk to folks about what that looks like. And here's contact information for me, and happy to help anyone out there who's looking for more information or resources or tools. And now I'm going to hand it over to my colleagues at Georgetown.
Thanks, Ellen. So Anna and I are really excited to talk with you about the Georgetown University Health Justice Alliance and our partnership with the School-Based Health Center at Anacostia High School. Let's make sure I can move. Okay. So I'm going to give you a little bit of background on the Health Justice Alliance, and then I'm going to let Anna talk briefly about the School Health Center, where she's the director. But our medical legal partnership is fairly new. And we were founded in late 2016, and we're a partnership between Georgetown's law and medical centers. And so we are training the next generation of leaders in law and health to work together to improve access to justice and access to health. And so we have a spectrum of learning opportunities ranging from classroom to clinical for law and nursing and medical students. And in particular, the key clinical part of our work, where we're on site providing legal services to patients, is through our law clinic at the law center. And our law clinic students are the ones who, under the supervision of our law faculty, are providing holistic legal services to Anna's patients. So I will let her introduce the School-Based Health Center at Anacostia.
Anacostia High School is a traditional high school located in Ward 8 of Washington, D.C. It's a neighborhood that has a particularly high burden of all the challenges that would tend to feed into poor health outcomes. The school is actually a very old school. I think it's been there almost 100 years. The student population is almost 100% African American, and all the students qualify for free and reduced meals. About 30% of the students are special ed students, and about half of the students are enrolled specifically with us in the school-based health center. We provide general pediatric medical services. We also have a nurse midwife who is present twice a month to provide prenatal care and reproductive health care. We have a social worker and a psychologist to provide mental health services. And about almost 2 school years ago, we started providing legal services as well through the Health Justice Alliance.
And just so folks understand sort of how the school health center fits into Georgetown, the MedStar hospital system, which runs the clinical portion of Georgetown's medical center, operates the school-based health center in Anacostia. So we're in many ways under one academic and clinical umbrella. Okay, and so I knew that was going to happen. Okay, and so when Anna and I were thinking about what we wanted to share for today, because we are still fairly new, we thought it would be helpful to share some of the learnings we have from actually getting an MLP in a school-based health center setting up and running. And so we're going to try and hit quickly on 4 sort of themes. One is how to get provider in terms of within the school-based health center and school official buy-in to the MLP model. The second is how to screen adolescent patients for legal needs. And then sort of what stems from that and a challenge that that is unique to school-based health centers is how to engage the patient's family in legal services if the patient, the adolescent, is not the potential client. And then lastly, a really key part of our work, because we are a law clinic with law students who are managing small caseloads, the importance of facilitating warm handoffs to other legal services providers or community service providers if the MLP is not able to serve them. So those are the themes that we're going to try and hit on for you today.
So one of the things that I felt in looking back at the last 2 to 3 years as we dove into this world of medical legal partnership, one of the things that really helped things go smoothly for us was that, for one thing, we had one of our partners on the law school side had experience with medical legal partnerships and setting up medical legal partnerships at other institutions, and so she was able to bring her lessons learned, which I think really helped us set the pace and set our goals at every stage of the rollout. And we kind of came together with this idea over a summer break, which really gave us the advantage of time in terms of laying the groundwork to start providing legal services in the clinic. The first challenge I thought was to really engage the entire staff of the school-based health center, both the clinical staff and the administrative staff, in the process, and help them to fully understand what a medical legal partnership is, what advantages it can provide for our students. And we were able to spend some of the low traffic times in the summer providing little workshops and informational sessions, and allowing the clinic staff to provide feedback to the lawyers in terms of how we work, what our patient flow looks like, what are the best ways to try to engage the students. And so that time of collaboration really helped things go smoothly as we rolled this out. The other thing that was a real advantage was that working with a law school partner was that we had a team of law students who were able to do a lot of research and needs assessment and to provide presentations for our staff and as well as for the school leadership, because that was sort of the second layer of buy-in that we really needed to get. And we were fortunate again to have a principal who really already was familiar with medical legal partnerships and really bought into the concept and was very supportive of our efforts. And then we had the law students as well come in and provide some presentations and trainings for both the school staff as well as the clinic staff. We also had the time to connect with some of the other resources in the school, the teen parenting program, the on-site daycare center. At one point, we had a homeless liaison in the school. We don't have one anymore. The school nurse, of course, the school nurse is co-located with us, so that was kind of an easy one. But yeah, the attendance counselor as well, some of the other administrators, the front office, and also, very importantly, the mental health team, the school social workers and the school psychologists, particularly with the IEP team, who, you know, they hear lawyer, and that's, you know, that's something we've got to get straight up front, that this is supposed to be mutually supportive and collaboration with the school, and that we hope to avoid any antagonism between what our lawyers are doing and what the school is trying to do for the students. So that gave us time to do this slowly and carefully and thoughtfully and get the buy-in of the school as well.
Anna, do you want to talk a little bit about screening?
Yeah, so what we came up with in terms of a process, and there was a lot of going back to the drawing board and kind of rethinking things and tweaking things, but we developed sort of a workflow in terms of how the medical legal partnership is put into play in our clinic. So we start out by screening. We conduct screenings, we call them screenings for health harming legal needs, when patients come for their well child checks. And we have a screening form. Right now it's on paper that they fill out while they're in the waiting room. It's given by the patient services coordinator, who really kind of gives them a pep talk about what it is, why they're filling it out, why it's important, and offers their support if they have any questions, which we have found really, really helps the students to want to fill the screening out and to take it seriously and to provide good information on that screening form. So they do that while they're in the waiting room before they get their vitals done and so forth by the school nurse. Once they've done that and once the provider goes into the room, we have that screening form to review with the student and to kind of dig a little deeper and ask why they answered certain things the way they did. We also use as one of our tools in the Well Child Check is the AAP Bright Futures platform that goes through a whole host of medical and social risk assessments. So we spent some time trying to tie those two things together. So in addition to our screening, medical legal screening form that we give in the waiting room, as we go through the Bright Futures questions, we came up with a series of ways in which we can kind of go deeper on the Bright Futures in terms of whether some of those things would trigger a referral to a lawyer. We spent a lot of time working on the actual waiting room screening form. We wanted to keep it at one page. We wanted to keep it appropriate to the reading level of our students and to hold their attention, because they do a number of screenings when they come in for their well child checks. We do mental health screenings. Sometimes they have to provide information for the enrollment purposes to the patient services coordinator. So they're answering a lot of questions. So we wanted to keep our part brief and easy, and as the least burdensome possible. So we tried to use plain language, we tried to use graphics. We sort of added the graphics in as we went along. As we learned this, we tweaked it and shortened it and added graphics. And we did do some focus groups with the students to find out what their reaction to doing the form was. And it's just part of the, it's part of the routine when they come in for a well child check. And it's phrased that way by the patient services coordinator. She says, this is a form we give to all our patients when they come for a physical, so that they all feel like, they're not being asked this for any particular question. We are always talking about trying to transfer the screening onto an iPad format, which we do already have in place that can, the student can fill out the form and it would upload directly into the patient chart. And then we do have, we have tried to train all our providers in terms of what's next, so that as we go through the screening tool and as we go through the Bright Futures, we can talk to the patient about why we're asking them these questions and what the next steps might look like.
Thanks, Anna. So we have side by side what our, on the left is what our screening tool that patients fill out in the waiting room looked like initially, which you can see was really text heavy and had a lot of questions. And then on the right is the version that we are currently using, which has the pictures like Anna mentioned, and we sort of clarified what the answer choices were. Sometimes students would go through the old version and just check yes to everything, thinking it was meaning they didn't have an issue with any of those things. So we made the answers really clear, and also thought it was important to include the maybe to sort of keep the door open for students who just weren't sure what that meant or were a little bit nervous about disclosing information about what's going on at home. We also tailored the questions to the legal needs that our law clinic at Georgetown is best able to help with. So we, that was some refinement after our first semester of providing legal services. We learned what types of issues the students and their families were facing, and also what the law students could be most helpful with. So we started more specifically screening for special education issues, third-party custody issues, public benefits issues, and housing conditions issues. And then we incorporated the AAP food insecurity questions because that's information that the school health center and the other clinics under their department are collecting. So it was easier to just loop that in. So we wanted to share both versions so you could see a little bit of the evolution of where we started and where we are now. This is what Anna was mentioning about Bright Futures. And Anna and I worked really closely to develop this. And this is just a snapshot of it. It's where we have for each question in Bright Futures, we have some follow-up questions that the provider could ask to identify a potential legal need. So if the provider is asking, who do you live with, and we're interested in trying to suss out if there is any custody or guardianship issues for that student, we've given the providers a few extra questions that they could ask, and then some information about when to refer to the legal team and how the legal team might be able to help. Because as Anna can attest, it can be scary for teens to think about being referred to a lawyer, and they might only associate lawyers with someone who gets involved when you're in trouble. And so having some examples of how a lawyer could actually help your family and be a support to your family can help adolescents feel a little bit more comfortable. So we picked the Bright Futures screening questions that sort of aligned with the legal issues that we were trying to screen for. So we don't have this for every question in Bright Futures, but for the ones that tie into legal issues that we're hoping to catch in patients. And I'm going to turn it back over to Anna so she can talk about that important connection of getting the teen's family involved.
Yeah, so the next thing that we learned was that once we were comfortable and familiar with what our conversations with our patients might yield in terms of concerns about health harming legal needs, we then learned that there's a whole nother process in terms of actually getting the patient to connect with the law team. So there were times when we had to, as Lisa mentioned, we had to sort of make sure that the student understood we were trying to help them and not do something that was, you know, that they should be scared of or mistrustful of. And what we also found was that since we're working with teens who are presenting in the clinic without a parent almost all the time, that the actual legal problem often was a problem of the parents. So the parent as the guardian really became the client of our medical legal partnership. So once we sort of got a sense from the student, then we needed to often talk to the parent directly to get their consent, to get them to sort of understand what was going to happen next. And often we had to rely on relationships that were already in place. So the sort of benefit and the beauty of school-based health centers is that you're in a place that the family is already familiar with. The student has a comfort level being at school. The family has a relationship with the school and an understanding of the school. And so we tried to capitalize on that in order to get the family to understand what it was we were doing and also have a sense of trust in the process. There were times when we had families who were sort of cautious, concerned, maybe had some stigma to overcome in terms of reaching out for the kind of help that we were offering. And we found that it was helpful to have that family member come to the school and meet with us face to face, so that we could kind of ease that acceptance of the services that we were providing. And we also can arrange for the law team to come down to the school-based health center to meet with the families face to face as well.
Selena, I don't know if I still have control of the slide. I think we just have one left. Okay. So really quickly before we pass it over to Erie, the last part that we found is really important is being able to facilitate a warm handoff to another lawyer, whether at a local legal aid or another law school clinic, because it's already, as Anna was describing, scary for students to disclose legal issues and to ask for help. And so to make sure that anyone that the law clinic can't help doesn't fall through the cracks or have to like run through a million intake processes at different organizations, whenever possible, we are connecting that person directly with another free lawyer that we have a relationship with to cut down on the red tape that they need to work their way through. And so we're hoping that even though our capacity is small in the law clinic, that we're increasing access to justice by connecting people to other free legal services. And I think that's it for us, so we will turn it over.
Hi, this is Martha. Can you hear me? I don't.
Yep, we can hear you.
Okay, great. I'm just looking for the control for the slide. Here we go. Okay. So again, my name is Martha. I'm a family nurse practitioner. I'm the medical director for Erie Family Health Center's school-based and adolescent program. We're a federally qualified healthcare center in the Chicago area, and we see over 72,000 medical visits a year. Our locations, we have 7 freestanding community health centers, 5 school health centers, and 1 adolescent center. Our mission is that healthcare is a human right. We believe that we should provide high quality, affordable care. We want to support healthier people, families, and communities. Seems like the slide deck is stuck. Okay. As previously mentioned, you know, looking at the social determinants of health, our journey with the medical legal partnerships began, I'm going to say, probably around 2008. We had a fellow who got a grant who came to us and said, hey, I'd really like to provide some legal services. He was a newly graduate attorney, and he wanted to work with elder law. And so we started referring patients who had elder law issues. But because we're a FQHC, we see all kinds of families and people who really wanted to expand the services. And in 2010, we developed a partnership with Loyola Law School, and I can't. Again, I'm sorry. I'm trying to advance the next slide. I'm kind of stuck. Is there any way, Tiara, can you get control to advance to the next slide?
We're having a little bit of technical difficulty, but Martha, you are the host now, so you should be able to advance the slide. We'll be right back up shortly. We apologize.
Okay. So right now, our medical legal partner, they say we see about 72,000 medical visits a year, and we currently see about 1,200 legal referrals from all of our centers. So we partner with Loyola, the Legal Aid Foundation of Chicago, and Equip for Equality. One of the things that we do that's a little different is because of our school health program, we don't want to actually make direct referrals to Loyola for special ed cases. We use a partner, and Loyola helps us connect those patients with other legal services. We do screen yearly for health risks and housing conditions, guardianship. We use the Bright Future screening tools, very similar to what was presented earlier. Okay. So one of the cases that I had referred through the Health Justice Project was a mom who had brought her children in for school physicals. And this is Miss Walker. She brought her kids in for school physicals, and we found that the younger children had high levels of lead. She was living in a Chicago public housing apartment, and when we discovered the high level of lead, she went to her caseworker and said, could she move? And she was very concerned that that her children were going to be permanently affected by lead. And they told her that her children's lead level wasn't high enough to allow her to move. What we found was, okay, I was just looking at your message. What we found was that the CHA, the Chicago Housing Authority, was not following the CDC's recommendations, which had been changed in 2010, which said that providers and healthcare professionals should intervene when a child's lead level is at 5 micrograms or more per deciliter. And Ms. Walker's youngest child's level was 15 micrograms per deciliter and was told that it wasn't high enough to allow her family to move. So then we tested all of the children and Ms. Walker and found that everyone had lead in excess of 5 micrograms per deciliter, and still the Chicago Housing Authority said, no, that wasn't reaching a level high enough per their policy to allow them to move. You can go to the next slide. So what ended up happening was we put out a press release, and we found that the policy that CHA was following, which had been set by HUD, was just not updated in 2010. They were using 20 micrograms per deciliter. And we caught the attention of Senator Dick Durbin, who listened to our stories and said, you know, this policy is just not correct. It's impacting families, not only in Chicago, but all over the country. You can go to the next slide. And so we had a roundtable, and the patients and the lawyers and the medical providers all presented the case to Senator Durbin that that lead is really important. It is one of the things that is associated with attention deficit disorders, that it causes permanent brain damage, that it impacts motivation, learning, impulse control, and even at lower levels of 5 micrograms per deciliter, 30% of children are more likely to fail the 3rd grade reading math tests. So that it's just imperative to keep lead out of a child's system if we can. That this is actually impacting more Black children, Hispanic children. 3 times as many Black children have levels that are elevated. And so that it's really, it was really critical that we got the federal buy-in to change the policy. Next slide. So Senator Durbin and a coalition put together the Lead Safe Housing Act for Kids of 2017 that requires pre-rental lead hazard risk assessments in all federally assisted housing with young children. It also gives the families, like Ms. Walker's family, the right to relocate if they feel that their housing conditions are not safe. And it also expands money for landlords to actually address some of the health hazards in public funded housing. Next slide, please. So our work has, not only we had the Chicago Housing Authority change their lead policy, we had HUD change federal standards for lead. We had the Illinois Department of Public Health change their lead policy. And right now, Illinois is only in a handful of states who are actually adopting the CDC standards for intervention. Our medical legal partners have helped thousands of patients in the Chicago area, in the Illinois area, and across the country. A couple of other really, I think, important legislative changes that some of our cases have helped us uncover and assist have been homeless youth benefits. What we were finding was that in Illinois, our state laws would allow confidential visits only, but if there was no parent or legal guardian available to sign paperwork, if the child had asthma or other health conditions, we really couldn't help them except for in emergencies. So we expanded access to health care for homeless youth, SNAP benefits for homeless youth, and also expanded confidential mental health services for adolescents in Illinois. And so I wanted to just kind of make a few recommendations that if you are considering starting your own medical legal partnership, you really might want to identify your needs. And I think those screening tools that were presented are really an awesome way to start screening your population to see what kind of legal needs they may have. I would recommend starting small. You can look at sometimes the way we started out, for instance, having a fellow come in to kind of like introduce us as an agency to this idea of medical legal partners was really helpful in getting buy-in from our agency. We also do a lot of training for providers to recognize the social determinants so that we can make more effective referrals. And then certainly sometimes, you know, starting a project can be really a lot easier than maintaining a project. But if you do get started, like we did, we were quickly able to see how a medical legal partnership really fit nicely within our mission as an agency to expand and to impact the community health parameters that affect our patients' health as individuals. And so we not only partner with Loyola, but we fund right now an attorney who handles quite a few of the referral process, and she'll take many of those cases. And so we've been able to maintain this relationship and have committed to sustaining this work that is so important. Anyway, that is kind of an overview of some of the work that we've done at Erie, and I certainly could probably go on for over an hour or more about lead poisoning, and I'd be happy to take any questions or you know, reach out to me if you have any other ideas how, you know, we can impact, I think, health in a bigger way across the country, because I think that we as school health providers really do see a lot of times the inequality that walks into our clinic with housing, with education, and just have an opportunity to really look at how we can impact bigger populations.
Great. Thank you so much, Martha, Lisa, Anna, Ella. We really appreciate this presentation. And like Martha said, if you have any questions, please enter your questions into the chat box or the Q&A box. And while you enter your questions, we do have a few announcements. We ask that you please join us as a member. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. Please visit our website for more information under memberships. And tomorrow starts our registration for our national convention. This convention will take place in the Washington, D.C. area at the Crystal Gateway Marriott Hotel. Please visit our website for more information about registration, location, workshop details, etc. And a reminder to our members, you get a special rate for our convention. That is June 23rd through the 26th. And we're definitely looking forward to seeing all of you there. So we do have questions that are coming in. So we just want to go ahead and get started with those questions. The first one is applying, I guess, for Anna and Lisa. Are you able, I know you gave a copy within your presentation, but can you also share, are we able to share other tools for screening tools and legal checkup tools that you may have?
Sure, this is Lisa. Yeah, Tara, that shouldn't be a problem. We can share versions of those. Just let me know where, like if it's easiest for me to upload them or send them so that folks can access them. And we just ask that that you credit the Health Justice Alliance if you adapt it. That's our only.
Definitely, we'll definitely go through that because this recording and the resources and the copy of the slides will be provided on our website in 3 to 5 business days. So we'll make sure we'll get together and get that information for everyone to include on our website.
Okay, great, thanks.
And also, how often do patients complete the screening? Is it when they become a new patient, at all physical examination, at all appointments?
This is Anna. We do the screening at every annual well child check. As a rule, occasionally if we get a new student who's coming in for an acute issue, they may say something that triggers a concern that we may just decide to have them fill it out. And sometimes we've had a couple cases where our staff have identified something concerning about the patient. We had a patient who was coming to school wearing the same clothes every day. And so the nurse suggested us, so we might want to find out what's going on with that kid. And another patient who was coming to school every day with a sleeping bag and a duffel bag. So that it's kind of a nice way to start that conversation by using the legal tool.
Okay, perfect. Thank you so much. Another question is, if the SBHC accepts patients, clients from the community at large, do those non-students or adults in the community get screened into the MLP as well?
So this is Anna again. We only serve the students in the school who are currently enrolled in the school. Some of our students are parenting, so we can also serve their children, but we aren't able to serve anybody from the general community.
This is Martha. We do serve people from the general community. We don't have a formal screener that we use for adults, but we do, it just as part of our assessment process, talk about their living conditions and do they have enough food and you know, what issues they may have in their home.
Okay, great. Thank you. Is there any specific advice about how to screen for domestic violence when patients are children or youth?
Anna, I don't know if you want to talk at all about the partnerships that you've built with Break the Cycle and other organizations that serve the adolescent population that are experiencing dating violence. That's sort of the closest we've gotten to that.
Yeah, so we do ask as part of some of the questions on the Bright Futures tool, directly inquire about, do you feel safe in your relationship? Have you ever been forced to have sex when you didn't want to? Those kind of questions. And we'll ask those same questions when we have students present for reproductive health visits. So those trigger some of those questions and help us identify concerns in that area. But as Lisa said, we do have additional legal partners. So the Health Justice Alliance is sort of a very specific relationship between our clinic and the Georgetown Law Center. And we have sort of a more limited, as I said, we kind of decided we're very deliberate about starting small and getting bigger. So as we found out that there were some cases that we didn't have capacity for on the law clinic side, we identified some additional partners who address specific concerns. So one of those was intimate partner violence, human trafficking, and legal concerns for teen parents. So that's part of, I think, built to the screening. Is not a specific screening tool for domestic violence or intimate partner violence, but it is sort of part of our best practices when we encounter someone for a reproductive health visit. So that's how we kind of get to identify those needs, and then we have partners who deal very specifically in those areas of law.
Great, thank you so much. We have great questions coming in, and just to let everyone know, if we do not get to your questions, we would definitely send them in to the prospective, to the presenters so that they can answer for you, and we'll definitely try to get back to you as soon as we can. But we're going to try to get a few more questions in while we have some time. So our next question is, how do you navigate the buy-in process with schools when it comes to education advocacy cases, in particular claims surrounding IDA, child fine, IEP/504, discipline, etc.?
I think, this is Lisa, I think Martha alluded to this, so I'll let her speak more in depth, but from the Health Justice Alliance viewpoint, we just drew some lines in the sand with the school, and so any special education cases or cases where the school would be on the other side of the table, we refer out to other counsel. We do not take those cases.
Yeah, hi, this is Martha. That's exactly how we do it. We put in the referral through the Health Justice Project, and then they have a warm handoff for those cases to an outside agency.
Okay, thank you so much. Our next question is, do your legal partners address immigration? They notice there are no questions in the legal screeners.
And in addition to that, if you can also speak to a question about providing know your rights type trainings on civil legal issues for students and parents. So do you address immigration and know your rights?
This is Lisa. We don't currently have immigration expertise in the law clinic. So we're not directly screening for that, but it definitely comes up at the other school-based health center that is part of MedStar, which sees a large population of immigrant students. So right now we do warm handoffs for those cases as well.
And this is Martha. Yes, we don't actually use a formal screening tool to identify those cases, but you know, it's kind of a tricky situation. Sometimes you don't want to write certain things down. If somebody were to come in and say, you know, we need to look at your records, we want to be careful to protect our patients. And we do refer many cases, and if our attorneys can handle it, they will, and if not, they also have other resources in the community. And our Health Justice Project partners have done many Know Your Rights workshops for our patients, and have information available for them. Sometimes this comes up as we're like screening people for insurance. So our navigators sometimes then identify those cases and make referrals to Health Justice Project.
Yeah, sorry, I forgot to answer that part of the question. The Know Your Rights stuff is a piece of the work that we're hoping to have our law students do more of as we get more established. We have created a couple of one-pagers for patients that providers can hand out, and we've consulted with the pediatric department that the school-based health centers fall under to create some food insecurity handouts for families, but we haven't yet had the opportunity to do the Know Your Rights trainings for the patients.
Great, thank you so much. And once again, if we do not get to your questions, we will make sure we send it to the respective presenters so that we can get those questions addressed for you and sent back to you. We do have quite a few questions about funding. So as far as funding for MLPs, let's see.
I'm happy to hop in on that.
Oh, perfect. And one specific is
okay.
funded in terms of like startup money and sustainability.
Yeah, so there are lots of different funding mechanisms that programs are using around the country. I can say that certainly philanthropy is an important runway towards sustainable funding, and we're going to be coming out with some financing tools later in the spring. But I'd also refer you to our health center issue brief, which is on our website, and we can has lots of suggestions on how health centers in particular are funding medical legal partnerships, including using enabling services resources. So again, lots of different ways to tackle this depending on the work that you're doing, the population you're serving, and the setting that you're in, and look forward to sharing those resources with you.
Okay, perfect. Thank you. Is there anything else that you all would like to add as far as funding or any additional information before we close?
I would just say that, not to speak on behalf of Anna, but I think we're both happy to talk with anyone offline that has more questions or resources. So feel free to reach out if you have additional questions. We want to spread the model far and wide.
Yeah, this is Martha. I mean, I think I did mention that, you know, we started out really small. We had a student who had a grant. We then partnered with an institution that had a lot of resources, and then ultimately decided that we also needed to fund a full-time attorney because our needs were being met, and they were so great that, you know, so we have a combination of ways that our program is funded, and so getting, you know, sometimes it can take a little while to get your institutional buy-in, but for us it was really important to continue this work because it was so important to helping our families.
Okay, perfect. Thank you so much. And again, as you can see on the screen, if you have any additional questions, please send your questions to the email provided on the screen at info@SBH for all, and we'll be sure to send those questions out to get them answered and sent back to you. Also, if you have any other additional questions, please feel free to send them to us. And as you can see, there are evaluation questions that are popping up on your screen. So you can please take time to answer those questions. And we appreciate and thank you so much to all of our presenters and all of our attendees today. And we hope that you have a wonderful day.